With more than 4,000 patients so far seen and over 300 major surgical operations, aside eye and ENT surgeries carried out on the third day, this intervention by the Akwa Ibom State Government is a gesture that has given back life and hope to many families. An elated Mr. Sunday Uye, who reported on day one with a bilateral hernia, is already on his way home, having successfully recuperated from the surgery. He has the governor, Pastor Umo Eno, to thank for the intervention that has turned around his medical condition.
I've been carrying this hernia for over 4 years or more, 4 years. And I was thinking, how will I, remove this? When I die of this, I have been experiencing some different kind of government as long as Akwa Ibom State is concerned. I have not seen this. My heart swells with joy. In fact, I keep on telling others that I have not seen such a governor. I've not benefited from governor to this extent. So I want to say kudos to our governor, and may God give him the strength and the power to continue this.
An inexhaustive roll call of satisfied post-surgery patients saw people alternate between tales of their pre-surgical experiences and the governor's magnanimity.
What the governor have done, I take them from firemen because I need a cabin market and the member that I go. I can get private hospital. I spent almost 270,000. This one again on market from its I still plan where I will get money to do it, but I thank God for that governor. Put on one year, you're going to offer with me. Which I have said, young on you.
I'm got on idea. Come for no bone, and then you for you. Then go for no. And you met a giant young you need it. The Macom, I was in Banga governor, and near in Bob. I'm Bangam and Kuru. You bring in a cook and the car for you some time. We don't dip another win. This way for you.
Umo Eno na meteti. And I'm giving for again or not to be the necessity. I've been Pastor Umo Eno. I didn't the governor. I need a test in bomb. I did it free medical. I mean, or jail. Ikot Ekpene. Lincoln and one of Awo boy did young Abasi. Nessia Fiber making fun 1 naira.
Parents and caregivers who had their wards attended to could not hide their gratitude to Governor Umo Eno.
So, yeah, and I'm no phone. My governor.
When the thing started, he was not able to meet up in classes because of the ill health. But right now, courtesy of our dynamic governor, Governor Umo Eno, I hail him. I say, may God bless him for doing this great job to the health of humanity.
I get the 9 years. Adia said, I didn't my song. So by saying, I mean, Kevin and Yendi Guami was said, Bake Uber Governor, Umo Eno, and I get a meme come song, and then I'm to fun. Pay Baba 1 naira. Keyboard Eno came fun, and our news so came fun.
Notwithstanding satisfactory reviews from the outreach, the Senior Special Assistant to the Governor on Medicals, Dr. Ekem John, says Akwa Ibom people should brace up for more interventions in the health sector.
His Excellency, the Governor, is very passionate about healthcare. Studies have shown that a lot of our people are unable to access healthcare because of the challenges of funding. So His Excellency is devising 2 strategies: the Akwa Ibom State Health Insurance Agency, whose bill has been passed, signed into law, and an executive secretary appointed, awaiting the appointment of the board. But in the short term, what can we do? And that is why His Excellency is responding in this manner, by putting up these short-term intervention strategies that will ameliorate the sufferings of Akwa Ibom people, especially in healthcare.
Some medical personnel on the outreach were full of gratitude to Governor Umo Eno for prioritizing citizens' welfare in this magnitude.
So there are so many cases that have been done. Like yesterday, I did a 3 vaginal hysterectomies, giving me prolapse of the uterus. And from the look of things, I don't think they could have been able to afford a kind of money and that would have been required for that surgery to be done. The governor is from the way he acts, from the way he functions, he is somebody who has the common person at heart.
There are a lot of people here that cannot afford for healthcare. Some of them are people that have gone to teaching hospital to see us. Some of them are people that have gone to general hospitals, and the cost had to chase them away. You see somebody carrying fibroid for up to 10, 15 years, looking for where help will come from, and the government has decided to render free health services to these people and saving a lot of citizens of Akwa Ibom State from spending so much. Out-of-pocket spending is just one thing that in this democracy we should try to minimize, because it's really taking, especially these times that we know that times are hard and people are struggling to have ends meet and also to feed. So
surgical fees are very expensive, and the high cost of things in Nigeria and the inflation makes it even harder for a common man to be able to pay out of pocket. But the cases we are doing here are cases that if someone has to pay in private hospitals or even some of the hospitals outside here, it would have been very expensive for such persons. Governor Umo Eno has done, this is not the first time, and I believe that he's also putting up plans to put it up in every other environment that people cannot access healthcare.